Hello, everyone. Thank you so much for joining me. My name is Dr. Princess Fumi Encock. People know me as your global vision midwife. Of course, others call me your compassionate trauma care maestro. Thank you so much for joining me this morning. All right, so I wanted to talk to you today about maternal mental health. How many of you know that a lot of times with us women, we tend to want to take care of everybody else but ourselves, right? Until something breaks or we go into a mental disorder or something, then all of a sudden we want to take care of ourselves, right? So it's actually important that even as mothers, as people who are pregnant, we do take care of our mental health, particularly in the times that we're in, the seasons that we're in right now, in the time of pandemic. It's important that we take care of ourselves. So, question, did you know that in worldwide, about 10% of pregnant women and 13% of women who have just given birth experience a mental disorder? Do you know that? Okay. I think I need to sit on that a little bit, right? And primarily, they suffer from depression, right? More than 1 in 10, more than 1 in 10 women develop a mental illness during this time. And if untreated, these illnesses can have devastating impact on women and their families, because how many of you know that we women, we are, we have men that are the head, are men at the head of the household. But when we talk about caring for our families, women are particularly the head. So it's important that we take care of ourselves. So having said that, what is maternal mental illness? Let's talk a little bit about that. Maternal mental illness is mental illness that occurs during pregnancy or in the first year after childbirth. Examples of perinatal mental illness include antenatal depression, right? Postnatal depression, anxiety, perinatal obsessive compulsive disorder. I'm going to talk a little bit about that some other time. Postpartum, when we talk about post, which means after, right? Peri, a little prior, right? And into the times when you are pregnant, all right? Some people even suffer from postpartum psychosis. And of course, we also have the post-traumatic stress syndrome, which is very prevalent right now with COVID, systemic racism, and all that's going on in America and across the world, actually. So these illnesses, they could be either mild, they could be moderate, or they could be incredibly severe, requiring different kinds of care or treatment. So who is at risk of these disorders? Virtually all women. Can I say that again? Virtually all women are at risk. Okay? Virtually all women can develop mental disorders during pregnancy and in the first year after delivery. So it's very important that we take care of ourselves. But, poverty, migration, extreme stress, exposure to violence like domestic, sexual, or gender-based, all of this can actually kind of increase your potential, your risk of having maternal mental illness, right? Emergency and conflict situations do make it happen. Natural disasters can also contribute to it. And of course, low social support generally increase risk. They do increase risk for specific disorders. So what are the effects of maternal mental disorders after birth on the mother and that child, that infant? After birth, the mother with depression suffers a lot, and I mean a lot, and may fail to adequately eat. They may fail to adequately bathe. They may fail to care for themselves, right, in other ways. Now, this may increase the risk of even other illnesses, All right. The risk of suicide is also a consideration. We have to consider that, the risk of suicide. In my clinic right now, I often meet with a lot of women that talk to me about having suicidal thoughts, suicidal ideation. Maybe they don't want to attempt it, but that suicidal thought and ideation is constantly just there, ringing. So the risk of suicide is also a consideration. And in psychotic illnesses too, I've had parents, mothers who after having their child, they just go into psychosis. This is very, very prevalent. Of course, you also have the risk of infanticide. You don't want a situation where you hand over a baby to someone who is already in a psychotic outbreak. Bad things tend to happen. All right. Though this is rare, but it also must be taken into consideration. Very young infants can be affected by and are highly sensitive to the environment and the quality of care. So if they are with a mother that just have a psychotic outbreak, they can sense it, because they're not getting the milk that they need. They're not getting the care. They're not getting the touch and the love. So they are going to, of course, sense it. And they are likely to be affected by mothers with mental disorders as well. So prolonged or severe mental illness hampers the mother-infant attachment, the breastfeeding, and the infant care. What impact, another question, what impact may maternal mental illness have on a family and society at large? Because, we always have to think about, it's not just about us in our home. We also have to think about the society at large. After all, these kids that we are bringing up, these kids that we are birthing are going to be a part of a society. So we want them to grow up healthy. We want them to know right from wrong. And so it's important that we begin even at infant, even when they're still in our bellies, right? So mental illness in parents often has a negative effect on the social, emotional, cognitive, mental, and physical development of children, right? So this can have a negative impact on their education, right? It can have economic impact on the potential of that child that was born in the country that child was born in. So therefore, addressing the mental health needs of mothers has positive implication for the well-being of women, their children, and families at large, as well as the wider communities and society. So here is my message to you today. Motherhood isn't meant to be done in isolation. Let me say that again. Motherhood isn't meant to be done in isolation. You don't have to face it alone, and you don't have to feel guilty asking for what you need. If you feel you're experiencing perinatal mental illness, you've got to speak up and ask for help. I've literally experienced a mother who had a child live on the 6th floor of a building and just drop that child. Drop that child. It wasn't something that she meant to do, but it was something that she did because of her mental outbreak, right? Seek help. If you or someone you know is affected by perinatal mental illness and you're looking for help, well, you came to the right spot, right? So you can always check us out on pobpsychiatry.com, pobpsychiatry.com, where we can give you more resources, where in fact you can get to probably talk to somebody. Perhaps we need to put you on a kind of medication or a little bit of psychotherapy and medication, because frankly, I do believe, as a psychiatric provider, I believe in the power of the combination, where you have the medication, of course, a little dose of that, correct that part of your chemical imbalance, and psychotherapy, where you have psychotherapy kind of maintain it, So until next time, be inspired, be motivated, be of sentimental value. Understand that you are the hero in your life story. Do not allow anybody to write your story in a funky way. Thank you so much for being a part of this. Until next time, it's bye for now. Bye-bye now.